we're going to start the ventilation perfusion ratio. So first let us understand what is ventilation and next perfusion, and let us both mix them together. So first ventilation. Ventilation is the amount of air which is reaching the alveoli for the gaseous exchange, and this is called ventilation, or also called as alveolar ventilation. So ventilation is nothing but the amount of air which is coming to the alveoli. Mainly it is useful for the gaseous exchange. So alveolar lungs are divided into three zones: the upper zone, middle zone and the lower zone. Lower zone is also called as basal zone. In an upright, we are talking about this situation in an upright person, that is, lung as apex and as a base. So base, it's placed on the diaphragm, right? So now you can understand the position. So if a person is upright, he or she has an upper zone, middle zone and a basal zone. So more ventilation is seen in the basal zone because of negative intrapleural pressure, which expands the lungs. So always remember, more negative intrapleural pressure which is present, it is expanding the lungs mainly in the basal zone, means in the last part of the lung. And the first zone has minus 10 of intrapleural pressure, and the second zone has minus 5 of intrapleural pressure. But you can see third zone has minus 2 of intrapleural pressure. Because of gravity, the less negative pressure is in the third zone. So in a third zone there is less negative intrapleural pressure. So because of this less negative intrapleural pressure only, the airways are expanded more in the case of last basal part. So as the lungs at the upper part are stretched against the gravity, they are more big. In middle part are moderate, and the lower part have smallest alveoli because they are according to gravity. So according to gravity, our alveoli are also stretched. Before we have talked, because of intrapleural pressure expanding the lungs have expanded, okay, but in the basal part. But we need to understand even how alveoli are expanded. In the If I draw a diagram, you can easily understand this. So for example, this is a lung. So lung, this is apex, this is middle part, and this is basal part. So we know we have alveoli in the three parts, right? So alveoli which is in the upper first part is bigger, but the alveoli which is in the second part is moderate in size, and the alveoli which is in the last basal part is smallest in size. But the blood flow, it is highest. Blood flow is highest in last part, and even the expansion of lung is highest in last part. But the size of alveoli is smaller in the last part. So this is the important one we need to remember. So upper part is less stretchable and compliant as compared, and they're already big, but lower part is more stretchable and compliant because they're small already in upright position of a person. So always remember, upper part is less stretchable because already here the alveoli is very big, but the last part is more stretchable because they're very small, so they have a chance to more compliance again. So in disease, alveoli become large, so it's difficult for ventilation, and when normally in a lower or basal zone, they are more ventilatory and healthier and more compliant. So now we may have a question like, among these three zones, which have higher ventilation? I mean, during respiration, which part of lung is more responsible for ventilation? The answer is third part, because the third part, you can see, it is smaller. So now as the air comes in, it can have a chance to become more bigger now. But you can see this second and first part is like least negligible here, because first part is already very big, now it can't take more air, and second part is moderate, so it can take some part of it. But third part, you can see, it is very small, so it has more chance of ventilation. So always remember, third part is greater when compared with second and first one, because third part is greater in blood flow, third part is greater in expansion, and even the third part is also greater in the ventilation. But the only thing is, third part is having smaller alveoli. So that is the main thing we need to remember. So mainly in diseases, so whenever there is a disease in ventilation, always remember alveoli become larger because there is disease larger. As it is larger, it has less compliance and it is difficult in breathing when the case of disease. So now let us understand perfusion. We have clearly understood ventilation, so let us collaborate both. So perfusion from up to down, perfusion is increasing from up to down, means even perfusion is also highest in our last part. So last part is dominant, that is the basal part. Here even the perfusion is very much higher. The third part, perfusion means nothing but blood flow, blood supply. So here 25 divided by 8 is the average, that is 13. In pulmonary arteries, the blood moves upward to middle zone, and perfusion pressure is highest in the lower zone, and the perfusion pressure is highest. So moving blood have mainly two factors, that is perfusion pressure and resistance. So upper zone has low pressure, more resistance, and lower zone has higher pressure and less resistance. So always remember, as the lower zone is having higher pressure and less resistance. Because of less resistance, it has more compliance, because more it is more allowing the blood flow and as well as the perfusion. So alveolar pressure increases, compression increases because bigger alveoli compress the capillaries in upper part and also increase the resistance, but whereas decreased pressure decrease perfusion. So this is what happening in the upper zone of alveoli. So in upper zone of alveoli, you can see it is very big. So because of its bigger nature, the vessels which are underlying it, they get compressed. So because of this, in zone 1 there is less blood flow or completely no blood flow, because the bigger alveoli compress the vessels and there is no blood flow, and even the perfusion is very low. The resistance is also very high. Whenever the resistance is high, the pressure decreases. This is actually in respect to pulmonary circulation, but in our systemic circulation, whenever the resistance is increased, then even the pressure is increased, but in pulmonary circulation it is reverse. And next, coming to alveolar, pressure is low, compression is low because smaller alveoli in lower part have lower resistance and higher pressure and higher perfusion. So this is about the lower part. So always remember, lower and the basal part has a higher resistance and also it has the higher compliance and higher perfusion. So from up to down, the part of the lung, slight increase in ventilation but greater increase in perfusion. So there is only slight increase in ventilation. From up to down, if you see, the ventilation power is increased, but when compared with blood flow, you can see blood flow and perfusion, blood flow is increase in blood flow is greater than increase in ventilation for the basal part. Means more than gaseous exchange, the blood flow, the perfusion is very high for the basal part. So minute ventilation. So minute ventilation formula is tidal volume into respiratory rate. This we already discussed in our ventilation chapter. So 500 into 12 gives you 6000 milliliters per minute. So out of 500 ml, 150 ml is trapped in the conductive and respiratory parts, which doesn't participate in air exchange. This is called as dead space. So it is called anatomical dead space. So only 350 ml of total tidal volume, that is the true air reaching to the exchange area. So the tidal volume is equal to 350 into 12. Why use 350? Because we have removed the dead space. So that gives us 4200 milliliter per minute, that is 4 liter of air per minute, which mainly participates in a gas exchange. So we have got the total, in the total lung capacity we have 6 liters or 6000 milliliters per minute, and even if you see the minute ventilation we have 6000 milliliter per minute. But among them, in that, if you remove the dead space, because we don't need dead space actually doesn't participate in exchange of gases. So if we remove that, we get a true air which is participating in exchange of gases is 4 liter of air. So about 5 liter of blood is passing through the lungs per minute, representing the perfusion. About 4 liter of air is passing through the lungs per minute, representing ventilation. So this is how we represent the ventilation and perfusion. So 5 liter of blood is passing through the lungs per minute, that is perfusion, because that is the blood flow, and 4 liter of air is passing through the lungs per minute, the true air which is participating in exchange of gas, that is a ventilation. So this both are together form ventilation, perfusion. So ventilation and perfusion are required for a perfect gas exchange. Both are interrelated. Without any one of this, they have no meaning for the gas exchange. So ventilation by perfusion, now we need to do that formula. So 4000, 4000 is a ventilation and 4000 milliliters, and perfusion is 5000, gives you 0.8. So the exact value of ventilation perfusion is 0.8. In this 0.8, here in pulmonary artery the carbon dioxide is 46 and partial pressure of oxygen is 40. So it is middle part near 1, ideal. So middle part of the zone of lungs is ideally near to 1. So it's like ventilation perfusion ratio, so we can say as it is ideally near to 1. So if the ventilation perfusion ratio is greater than 0.8, means in the upper part where the ventilation is wasted, because ventilation is increased but the perfusion is decreased. So always remember, you can remember this 0.8 ratio is related directly with the ventilation. Ventilation is directly proportional to 0.8. Whenever the ventilation is increased, then this is also increased. So in upper part, ventilation is wasted. Why we say ventilation is wasted? Because here ventilation is very more, but the blood which is coming is normal. So lot of air is coming, but blood is taking only how much it want. So here the extra ventilation is wasted. So that ventilation is wasted because ventilation is very high and the pressure is very perfusion is very low. So there's gradual increase in ventilation and dramatic increase in perfusion from up to down parts of the lung. So if the ventilation pressure, ventilation by perfusion is less than 0.8, as I said, ventilation is directly proportional to this 0.8 value. Now you can estimate. If it is less than, they're saying less, means less 0.8 means less ventilation means higher perfusion. So in this case, so always remember which is higher, that is wasted. So here perfusion is higher, so perfusion is wasted, right? So in the lower part of the lung, the perfusion is wasted because the perfusion, more blood flow, already in the lower part of the lung there is higher blood flow. So because of higher blood flow, the perfusion is wasted, but the air which comes is normal, so ventilation is decreased. So now we have understood ventilation by perfusion is normal, is equal to 1 in the middle part of the lung, but ventilation perfusion is highest. Ventilation by perfusion ratio is greater than 0.8 in our upper part of the lung, whereas ventilation by perfusion ratio is less than 0.8 in the lower part of the lung, because in the lower part of the lung there is higher blood flow. Higher blood flow means higher perfusion, means the perfusion is wasted because the ventilation is low. So in alveoli, mainly the partial pressure of oxygen is 100, whereas the partial pressure of carbon dioxide is 40. But in arterial blood, the partial pressure of oxygen is 100, same, but the partial pressure of carbon dioxide is also same with alveolar blood and arterial blood. In pulmonary artery, carbon dioxide is 46, somewhat higher when compared with arterial blood and alveoli, and oxygen is lower, 40. So you can see in ventilation by perfusion is equal to 0.8 in the middle part. So in the middle part, these are all the values of alveoli, arterial blood and pulmonary artery. So you can see it's perfectly equal to 0.8 or equal to nearly 1. Whereas coming to the upper part, in upper part we are saying ventilation is very high, means ventilation is wasted here. So here ventilation is wasted means you can understand, I think oxygen will be high. Pulmonary artery is same to the above. Alveoli oxygen is 100 and carbon dioxide is lowered, and arterial blood carbon dioxide is lowered, but the oxygen is very high, 100 you can see. So this is the reason why ventilation is wasted here. Next, coming to ventilation perfusion is less than 0.8, where increased carbon dioxide in alveoli lower part. So here less than 0.8 means ventilation is decreased, means perfusion is higher, means blood flow is higher. So when the blood flow is higher, you can see in alveoli oxygen is 100, whereas carbon dioxide has increased to 42, and even in the arterial blood you can see oxygen is less than 100, whereas carbon dioxide is greater than 40. So that's what they're saying. In the lower part, the carbon dioxide is increased in alveoli. So PCO2 towards the venous side is 46, in the alveoli it's 40, in the arterial side it's 40. So let us start from arterial side. Arterial side it is 40. Venous side it is 46. Whereas in alveoli it's 40. Means 6 is added. In extra ventilation, fresh air more enters the alveoli and washes away the carbon dioxide pressure to 30. To all alveoli and arteries, their carbon dioxide is 30. So because whenever there is higher ventilation, it may wash away some of the carbon dioxide. So the partial pressure of carbon dioxide decreases whenever the ventilation is high. So carbon dioxide plus water, they form the bicarbonate, and later H plus and carbonic acid. So it's a buffer system which is normal in blood. And when in hyperventilation, we wash away the bicarbonate decreases, and H plus in the blood develops the, this pH in plasma. As now the condition H plus is low, they release their H plus, alkalosis and more calcium. So alkalosis takes place whenever in hyperventilation carbon dioxide is washed away. So you can see it binds to the plasma protein. There is now deficiency of calcium and lead to hypocalcemia in that hyperventilating person. So the whenever the person is hyperventilating, then the carbon dioxide is washed out. So because of this, the H plus is decreased, and because of that, the calcium is also decreased, causing hypocalcemia. So in bone cells, the sodium channels are guarded by calcium channels because the calcium goes to plasma place now, sodium becomes unguarded and more excitable due to more influx of sodium and form abnormal action potential and may also produce some cramps and faint. So that's why when a person is hyperventilating because of carbon dioxide washout, because of all these conditions, because of hypocalcemia, and as the sodium channels are guarded by calcium, because now calcium goes to plasma and sodium becomes unguarded, action potentials are formed and abnormal action potentials are formed leading to cramps and fainting. So we can treat this person by putting a bag so that carbon dioxide is restrained there and again ventilated back to the person and increase carbon dioxide level back to the normal. So actually this is in hyperventilating person, because of decrease in carbon dioxide this problem is formed. So when we put a bag to his mouth, the carbon dioxide which he produces only again goes back to him and it gets normal. So when any foreign particle entering lungs, ventilation decreases. So ventilation decreases means ventilation perfusion is less than 0.8. Whenever ventilation perfusion is less than 0.8, is perfusion is wasted because higher perfusion. So because perfusion is maintained, then the blood leaving the lungs will have low oxygen and higher carbon dioxide. Because we are saying here perfusion is wasted. Perfusion is wasted means it has not normal ventilation. Means you can understand the carbon dioxide has increased. So remain in same values of venous side as there is no ventilation or gaseous exchange. So this is called just shunting of blood from the venous side to arterial side. So you can see in this case, because the ventilation is low, it's like almost equal to no gaseous exchange has taken place. So like the same values of oxygen and carbon dioxide are also on the venous side. So this is called just the shunting, means just the blood is moving from arterial side to the venous side. Or hypoxia occurs, then vessels constriction in nearby arteries and divert the blood flow of blood to other functional parts in the lungs, and this is called hypoxia induced vasoconstriction. So normally in our systemic circulation, whenever there is low oxygen, our blood vessels get dilate and try to produce more blood flow so that they can increase the oxygen concentration. But in pulmonary circulation it's completely reverse. You can see whenever there is hypoxia they lead to vasoconstriction. Why? Because whenever those kind of vessels are constricted, they try to deviate this blood to the other parts of the lung where the oxygen is rich, so that that part can get the that blood flowing through it can get the oxygen. So in obstructive chronic disease it leads to hypertension due to constriction of vessels. So sometimes in obstructive diseases, like whenever the air is obstructed means ventilation is decreased, means the perfusion is very high, so here all blood vessels may get constricted and it may lead to the hypertension, pulmonary hypertension. So in this case, as blood is diverted to other functional areas and it gets normally oxygenated but should mix with the blood of affected area to drain into the heart, so the oxygen content normally decrease in this case. So even though here the blood is diverted to the other parts, finally it should pass through that even constricted artery, because finally it should go into her heart side, so for sure it should pass through it, so the oxygen content may be decreased even though it is diverted. So now let us see case 2 here. If perfusion is disturbed by thrombosis, like some thrombus has come, so perfusion is decreased but ventilation is high, means here ventilation is wasted, then ventilation perfusion will be greater than 0.8, right? So then ventilation is wasted in this case. So alveolar gas become like inspired air when carbon oxygen is equal to 150, as oxygen is not leaving into the blood, and here carbon dioxide decreases as carbon dioxide is not coming from capillaries. So you can understand, because of thrombosis the blood has stopped. If the blood has stopped, the carbon dioxide will not come into alveoli now, so carbon dioxide level is decreased, oxygen level is very much increased because now this is getting higher ventilation. So this is the case when there is thrombosis. So tip you can remember, like V is directly proportional to V by P, that is whenever V is increased then ventilation perfusion is also increased, means ventilation is wasted. Whenever V is decreased means V by P is also decreased, means less than 0.8, the perfusion wasted. So always remember here the bronchi constrict whenever ventilation is wasted, and whenever the perfusion wasted the vessels constrict. So when blood flow is decreased, bronchi constrict. When airflow is decreased, vessels constrict. That is, they require oxygen. Endothelial cells have nitric oxide producers which are oxygen sensitive, and they keep smooth muscles relaxed. But when oxygen doesn't reach these sites, they make the smooth muscle constricted. So during hypoxia, vessels are constricted. So the for constriction of vessels during hypoxia, we also got another reason like nitric oxide producers are mainly oxygen sensitive, so they keep the smooth muscles relaxed, but whenever oxygen reaches the site, they make the smooth muscle constricted. So during hypoxia, vessels are constricted. And endothelial cells have an enzyme called nitric oxide synthase, which can give rise to nitric oxide, produce nitric oxide. So these are all things, important things we need to know in the ventilation perfusion ratio. Very simple.